Welcome to Module 2. The purpose of this module is to illustrate how practitioners and billers can use the new G-codes to equalize the reimbursement rates between treating eligible beneficiaries in nursing facilities versus a hospital. You will also learn how to bill for practitioner participation in nursing facility care conference. Please note, the payment reform model and its new billing codes applies only to Medicare beneficiaries who meet the following eligibility criteria as determined by the nursing facility. Eligible residents must have resided for 101 cumulative days or more starting from the resident's date of admission, be enrolled in Medicare Part A and Part B fee-for-service and Medicaid, or Medicare Part A and Part B only, have agreed to participate in the program, reside in a Medicare or Medicaid certified bed, not be enrolled in a Medicare managed care plan, and have not elected Medicare hospice. The new Acute Nursing Facility Care CPT code is G9685. This code may be used only for the first visit in a nursing facility in response to an ATOP2 participating beneficiary who has experienced an acute change in condition to confirm and treat the diagnosis. Key components required: a comprehensive review of the beneficiary's history, a thorough in-person examination, medical decision-making of moderate to high complexity, counseling and/or coordinating care with nursing facility staff and other providers consistent with the nature of the problem and the beneficiary's and family's needs. The maximum reimbursement is one time for an acute change in condition for a single beneficiary. To qualify for payment, all medical practitioners must confirm diagnosis through an in-person evaluation or telemedicine assessment. The evaluation or assessment must occur by the end of the second day, but no later than the fourth day after the change in condition. The evaluation must be documented in the resident's medical record. The facility must be able to provide the required interventions. All services must be provided in-house by facility staff or contracted service providers. The duration of the benefit is specific to each of the following 6 conditions. Pneumonia. The qualifying diagnosis requirements are a chest x-ray confirmation of a new pulmonary infiltrate, or 2 or more of the following: fever greater than 100 degrees Fahrenheit oral or 2 degrees above the baseline, O2 sat less than 92% on room air or usual O2 setting in residents with chronic O2 requirements, respiratory rate above 24 breaths per minute. Evidence of focal pulmonary consolidation on exam, including rales, rhonchi, decreased breath sounds, or dullness to percussion. Congestive heart failure. The qualifying diagnosis requirements are chest x-ray confirmation of a new pulmonary congestion, or 2 or more of the following: O2 sat less than 92% on room air or usual O2 setting in residents with chronic O2 requirements, new or worsening pulmonary rales, new or worsening edema, new or increased jugular venous distension, BNP greater than 300. COPD asthma. The qualifying diagnosis requirements are a known diagnosis of COPD or asthma, or chest x-ray showing COPD with hyperinflated lungs and no infiltrates, and 2 or more of the following: symptoms of wheezing, shortness of breath, or increased sputum production, O2 sat levels less than 92% on room air or usual O2 setting in resident with chronic O2 requirements, respiratory rate is greater than 24 breaths per minute. Skin infection cellulitis. Qualifying diagnosis: a new onset of painful, warm, and or swollen indurated skin requiring oral or parenteral antibiotics or antiviral therapy. If associated with a skin ulcer or wound, there must be an acute change in condition with signs and symptoms of infection, such as purulence, exudate, fever, and new onset of pain, swelling, or induration. Fluid electrolyte disorder or dehydration. The qualifying diagnosis requirements are any acute change in condition and 2 or more of the following: reduced urine output for 24 hours or reduced oral intake by approximately 25% or more of average consumption for 3 consecutive days, new onset of systolic BP less than 100, 20% increase in BUN or 20% increase in serum creatinine, sodium less than 135 or greater than 145, orthostatic drop in systolic BP of 20 or greater. Urinary tract infection. The qualifying diagnosis requirements are greater than or equal to 100,000 colonies of bacteria growing in the urine with no more than 2 species of microorganism, and 1 or more of the following: fever greater than 100 degrees Fahrenheit oral or 2 degrees above the baseline, peripheral WBC count greater than 14,000, dysuria, frequency, new or increased incontinence, altered mental status, hematuria, or costovertebral angle pain or tenderness. The Nursing Facility Conference CPT code, or Care Conference code, is G9686. For this program, a care conference is a participation in an on-site nursing facility conference with the resident and/or resident's representative that is separate and distinct from an evaluation and management visit. A care conference includes a physician or other qualified healthcare professional and at least 1 member of the nursing facility interdisciplinary care team. The care conference must be conducted with the beneficiary and/or individuals authorized to make healthcare decisions for the patient as appropriate. The conference must be a minimum of 25 minutes. Without performing a clinical examination during the discussion, it must also include at least 1 member of the nursing facility interdisciplinary team. The maximum benefit period is only once per year per beneficiary. There is one exception. The code can also be billed within 14 days of a significant change in condition that increases the likelihood of hospital admission, even if the code had already been billed less than 1 year previously. In this case, the minimum data set or MDS assessment for a significant change in condition is required, and a KX modifier must be added to the claim. Lastly, the conversation and acute change in condition must be documented in the beneficiary's medical record. You have now completed Module 2 of the ATOP Billing for Practitioners course, Clinical Conditions and Billing Criteria. Up next, avoiding common billing mistakes. But first, click below to test your knowledge of the ATOP2 program's billing criteria.